everyone. Welcome to the Soul Talk. Today we have Dr. Sanika Sudeshkumar Dharaskar with us. She is a psychologist, psychotherapist, RECBT practitioner, TIA practitioner at Ali Ayer Hospital in Mumbai. We welcome you, Ms. Sanika, with us. And it would be very nice if you just give a brief introduction about you.
Sure. Thank you, Akriti, and thank you to Soul Talks for inviting me here. Yeah, so I'm Sanika Dharaskar. I'm a clinical psychologist and psychotherapist practicing from Mumbai, and I've been practicing since 7.5 years now. So I practice as my private practice in Mira Road and Vasai, as well as I practice at Ali Aur Hospital of Mumbai. That's Bandra.
Okay. So welcome, Dr. Sanika. And
Thank you.
the topic, that we have chosen for today is COVID a bane or a boon to our mental health? Surely with the uncertainty and with the COVID, people had actually considered COVID to be positive as well as negative to their mental health. So we would begin with our session. So according to you, how is COVID a bane towards our mental health?
Absolutely. Now that the topic is very, interesting and flourishing, and people have been facing a lot of issues, I wouldn't tell COVID is completely a bane or a boon, but as a human being or as a normal people, we have faced a lot in this COVID. We didn't even think like what particular unprecedented behavior would come to us. So surely it's a bane for everyone. It has taught us a lot, as well as not only adults but also children's.
Right.
Why it is a bane to especially mental health? Because we never thought that this thing might arise and this would have gone through so much that it could have taken a toll on our mental health.
True.
That students, children's, adults, we all are going through some of the other spectrum of psychological health issues, mental health issues, not only mental health but also physical health.
Right.
We have been facing all sort of respiratory problems, headache, complaints, physical illness, emotional burden.
Right.
We never thought of one that it will come, in our way.
Right.
And as it has come a lot, people didn't even imagine that this will come and this will hit us like, a volcano.
True.
People are into completely denial.
Yeah.
True. And yet, people have managed to survive. That's a great thing. But still, people are not in that zone to accept it. Still, people are having lots of questions and lots of fear. What if this happens again? So there are lots of scars which is there because people are not ready to take it on yet.
Right. Right. So, as we have just discussed that COVID is considered as a bane, but for some, it is actually considered to be a boon. So,
Yes.
how would you describe that?
True. So as it is a bane, as it is a distress for everyone, that it came literally unshockingly in mid of everything. Everything was shut down. But if I talk about a boon, as we can't only see disadvantages in everything, there had to be also the pros and the cons. The life is full of pros and cons, right?
Right.
So boon to our mental health, what I'll say is, where people were detached to each other, now people have been attached to each other, where people were not having time to sit with each other, talk to each other, spend some quality communication with each other. We have faced a lot of this good things also.
Right.
We do see the negative aspect a lot, but yes, if something is happening wrong, there is something to good also to happen in life. True. So there is a boon that everyone is communicating, everyone is together in once,
Yeah. Yeah.
a good emotional bonding with children, where parents used to come and complain, ki ma'am, bacha time nahi deta, parents are not giving time to children, parents are not giving time to themselves as well.
Right.
So it has also taught a lot of lessons, like it is a great boon, not only disadvantage, but also an advantage in many other forms.
Right. So how, as in, you said that you are seeing patients also, people come across for therapies to you. So
Mhm.
how actually are they considering COVID for them? I mean, do they come and say you that ये तो बहुत ही बुरा हो रहा है हमारे साथ, या they feel like कि ठीक है जो भी हुआ है, I mean they have an acceptance to it, that they have
Yes,
an insight to it. So how would
true.
you say actually that how it is affecting people's mental health? I
True,
mean,
true, absolutely. So what I would say is, in terms of adults that now they have accepted, they're working from home. Now they're barely very used to it.
true,
And
true.
now when I talk about children, still parents and adults are highly in stress, in distress that अभी जब मैं मेरे बच्चों को बाहर भेजूंगी, what
Mhm.
if COVID comes and hit them? You know,
Right.
because now I don't have any capacity to lose someone, because
Mhm.
that is a grief what parents are going or the adult is going.
Right.
Because I've seen people losing from other particular lives.
True.
That is the scary thing.
Right.
But if you come and ask me, I would rather say that in my practice we have to psychoeducate them and be with them throughout the constant support.
Right. So how about the kids? I mean, because we see that schools, I think they're not opening anytime soon.
Yes,
So,
yes,
like, there has been any instance when a kid is coming up to you, or you have met a kid. So how it
hmm.
is affecting their mental health? I mean, uh,
Absolutely.
do they consider it as a boon or as a bane?
For kid it is completely a pain.
Right.
Because if kid is coming to me, the kid is not happy at all, because when the kid used to be in school, they used to at least say कि मैम break मिल जाता है, we get PT proxy period, we get good, we go and talk to counselors, we go
Huh.
and chit chat with teachers. So there was physical movements a lot. Now at home people students are not at all comfortable. Why
Right.
are they comfortable? Because late utna hai. That also, some schools have their own schedules, most of the
Right.
schools.
Right.
But when students come and talk to me, they are like, I don't want to sit for a long time on this chair, you
Hmm.
know, because continuously sitting, continuously listening to the lectures, that is overburdening them.
Then
And
true.
when that is overburdening them, students are going into lots of mental health stuffs.
Right.
They're having lots of anxiety, they're having lots of screen addiction, which is
True.
literally on the high pair.
Yeah.
Parents are highly concerned and parents are highly insecure कि मेरा बच्चा सच्ची में लेक्चर अटेंड कर रहा है कि उधर गेम खेल रहा है.
Yeah, right, right. Yeah, but coming to the addictions, I'm pretty sure you must be getting across a lot of parents complain. And with
Yes.
the addictions also, if we speak, it is, I think, with the games and I don't know, what else addictions do you have come across?
So I've come across mobile addiction, I've come across gaming addiction, again the same. Then even I've come across students surfing pornography,
Right, right. Okay, yeah.
because so the adulthood where the puberty age is there, parents think my child is starting, my child is, because colleges and the universities are closed.
Right.
But if the parents are going and checking the history, there are some other lots of stuffs.
True,
But
true.
again, as a psychologist, I would like to mention that parents are highly insecure than their own
Ab-
child.
Absolutely, absolutely.
Right?
Yeah.
Yeah.
So what is your take, on the mental health once you see that, the parents, when it comes to parents or when it comes to working professional or with the kids. So how
Mhm.
do you see that COVID has actually like affecting their mental health? To what extreme?
Absolutely. Now, when I talk about the affection part, very important, COVID has taken on everyone. Then,
True.
when I talk about the affection, it has affected mentally, it has affected physically, it has affected behaviorally, as
Hmm.
well as it has affected psychologically. Now,
True.
when I talk about psychologically, it has many spectrums to go in.
Right.
So, adults are going under anxiety. There is lots of hyper impulsive behavior,
Okay.
lots of conduct disorder. Now, when I mean to say conduct, is like child is taking all the emotional outburst on parents,
Okay.
because child is continuously at one place and child has no one to talk to.
True. True. Absolutely.
So
Yeah.
all
Because
that
he's not
mental
going.
behavior
Yeah.
is
True.
coming in the form of behavioral issues. Child is
Okay.
getting irritated, child is getting messy, where
Hmm.
he can't even imagine his mental state or her mental state.
Right. Right.
And second thing, school counselors are also not available.
True. Absolutely. Absolutely agree on this. Yeah.
And as we are in Indian society, not all parents are open-minded to understand the child.
True.
So child is going to n number of things when the child is alone at home.
Yeah. I mean, coming to this point, actually, I just want to, there's a personal question coming in from my side.
Sure.
As you said, that Indian society is not actually very ready
Yes.
or very open to accepting the stigmas, with the mental health. So
Hmm.
you as a psychologist, when you practice, so I like, with regards to with the COVID and also it's there. So do you
Mhm.
think like, people are more actually opening up towards with the mental health, or they are still attached with the stigmas and they're actually diagnosing themselves and are getting treated by themselves?
Absolutely. Many of the parents now who are educated, who are being aware, who have been psychoeducated, they are also having good rapport, and now they have been starting to open up
Right.
about what the illness is or what the concern is. I would
Hmm.
not define here the illness, but surely concerns, parents are looking into the broader spectrum and
Okay.
parents are understanding. But on the second hand, I would also tell that many of the parents are ignoring and neglecting that my child is really suffering from something.
Right.
They are least concerned, chalo, they are least bothered about what's happening in their life
Right. Right.
because parents self are busy, work from home.
Right.
So when they don't have time for themselves,
True.
what are
True.
they going to give time to their kids? And
Ah,
that is the biggest point where mental health comes in, and where the child suffers.
the biggest challenge. Yeah.
Biggest challenge.
Yeah, I can feel like, I mean, absolutely, I can feel you. But apart from parents, with the, I just want to know about the awareness the India,
Mhm.
the Indian society has. So the
Yes.
same question, when it not with the parents aspect, but yeah, with the general population of India. So do you think like the mental health thing has more started coming in with the COVID, or it was there before, but people were reluctant, and still people are
Yeah.
reluctant?
It was there before, but people didn't accept it. Now, since the COVID has come, since
Right,
there is lot of information coming around the corner, since the media has come into the picture,
right,
now it is more into like concern ki now I have to go and get help.
right,
Now why it's the help needed? Because people are feeling isolated, plus people are having one sort of fear. Abhi aage kya hoga? What if I don't take care right now? What's my future going to be?
true.
Right? And
Yeah,
in this all the mess, now people are concerned, parents are concerned about child, adults are concerned about self,
right,
physically, mentally, financially also,
right, right.
because people have gone through a lot of financial issues. So
Absolutely.
now people don't want to come into that grief and again take the same trauma what they have faced earlier. So it's
True.
better to take precaution for foremost further.
Right, right. So yeah, how you actually, you want to tell this thing to the people that how do they overcome the negative impacts of COVID on the mental health?
Absolutely,
What are the
absolutely.
steps?
So very first thing what I would like to say is whether it be parent, whether it be kids, whether it be anyone, as self individual,
Right,
first we need to calm down on ourselves. We need to accept whatever is happening, that is all right.
right,
Some things are not under our control. Some things we don't know what's going to happen. But we need to mentally and physically be prepared to overcome the obstacle.
true, right, right,
Right? Second thing, what you can do is you need to be very supportive with your interpersonal relationships. Let it be
okay,
your relative, let it be your friends, let it be your own children,
okay,
because that is your support system.
true,
Only you are not aware, but your children are also aware what is happening and how you can cope up with it.
right,
So it's
right,
very important to share the things out internally as well as externally.
right, right,
It's very third is you need to have a communication.
okay,
Whatever you feel, please express that I'm not feeling well.
right,
I'm not feeling all right. If
right,
we are hesitating as a parent or as an adult, kid
hmm,
will hesitate more.
right, true, true,
So it's very important. Self care and self calmness needs to be there.
right,
Sec- Second thing, what you can do is
Yeah.
You need to spend a lot of quality time with your family, where you don't come across any sort of negative thing in your life,
Okay.
or you don't start missing out, you don't start feel isolating.
Okay.
Always make yourself happy, make yourself time for yourself.
Okay. And how would you actually tell? So if a person comes up to you, or maybe the clients, they do come up to you. So how do you tell them to practice the self-care? I mean, it would be
Yes,
nice if you could just say our audience also.
sure. So how will you have a self care? First of all, find a way that you want to be with yourself.
Okay.
What you like, explore what you like, explore whom do you want to talk to, explore what is your needs and desires.
Okay.
आप देखिए आपको क्या पसंद है, आपको म्यूजिक पसंद है, आपको डांस पसंद है, आपको और कुछ घूमना पसंद है.
Right.
अभी कोविड है तो हम घूम तो नहीं सकते, बट यस हम बिल्डिंग के नीचे तो जरूर घूम सकते हैं.
G G.
Right,
Absolutely.
we have a video call, we have an audio call to do. Make sure you do something productive with
Right.
your kids as well as with self. It's
Right.
very important. And mostly as a psychologist, I would like to say, whether it be child or an adult, please practice mindfulness meditation.
And how would you actually tell them? I mean, for mindfulness, I mean, have, I think आधों को नहीं शायद पता होगा कि mindfulness.
Right.
Yeah, yeah.
So
So,
what you can do
tips.
is,
Right.
so make sure just take out 5 to 10 minutes, sit with yourself or sit with a kid, fold your legs, keep a quiet room, keep a room in a darkness, close your eyes,
Right.
slowly breathe in, feel that breathe when you're doing it. Hold on the breath for 2 seconds, again feel the breath, and then release it out.
I mean, I
And
can.
when you are doing this, imagine the beautiful things that you have been through, or the party that you have done, or the
Okay.
beautiful memory that you have created.
Right. Right.
So all you have to do is be in the present moment. Let the distraction come. But that's very important to calm your mind and mental health.
Right, right. I mean, I can imagine once you were saying the steps, I could actually feel it. So I'm actually pretty sure. I mean, the people who would be practicing, our audiences and everyone, I mean, they'll feel a lot of difference. So, Sanika, as a therapist and as a psychologist, what are your, views about this COVID and the mental health? I mean, how would you actually tell your clients, or how would you tell our audience also to take care of
Absolutely. So you need to first of all be safe with yourself.
right.
Please make sure you're wearing a mask.
True.
Second, make sure you are sanitizing your hand and your whole body wherever you're going.
Right.
And more than sanitization, wherever you go, whatever you do, wash your hands. That's very important.
Right.
And wherever you sit, make sure you are at the safest place, and 24/7 be protected with what you have.
Okay. Okay.
Yeah,
And one more question, Sanika, that is, people, I mean, they have a lot of uncertainty. They have a lot of questions that keep on coming to them when it comes that maybe COVID will be there. There would be a fourth wave or a fifth wave.
yeah.
So what would be your message to them?
True. Now that we have survived the first wave and the second wave, now as Indian citizens all over the world, not only Indian citizens, we are used to it now.
Right.
But in life, always this scenario is going to come. We have to prepare ourselves not only for this scenario, but to overcome any obstacle that is going to hit.
Right. Right.
Always teach your child, always be prepared for yourself to take on anything in your life, because that thing we haven't seen, we haven't learned,
Right. Right.
but we have survived through it.
True. True.
Now also we are surviving. It's a biggest blessing.
Mm-hmm.
So don't ignore it. Just be with it. Don't exaggerate it. Don't get anxious about it. But yes, just be far away from it, and
Right.
make sure you be internally like self-aware and be calm in that situation.
Yeah, I think having an insight and reaching out
Yes,
to people whom they trust or they want to feel like
true.
talking to, they should do, right?
Talk to the one who you know, who are close to you. There are
Right.
doctors, there are clinical psychologists, there are psychiatrists, there are school counselors in
Right.
terms of students.
Right.
So we are not operating, though everyone is not operating offline, but yes, online you can go and seek help.
Right. So there's this, I think, questions coming up. We have actually seen two types of personalities. That is, one is extrovert and one is introvert. So for extrovert, how, I mean, for you, how difficult it is for an extrovert, to fit into this scenario when the person is not able to go outside or to meet someone and it's not socializing. So how would you actually say the impact of COVID on the minds of an extrovert and an introvert personality?
Absolutely. That's a very interesting question. Lovely. So as Akriti has said, me two types of personality, extrovert and introvert. Extrovert is like a very talkative person. And
True.
extrovert can't sit at one place. Extrovert is like an hyperactive kid or an
Right.
hyperactive adult, right?
Right.
So back of the mind, some of the other things must be going,
True. True.
right? So what an extrovert personality or students can do is, or adult can do is, give a call to your friend, be
Right.
with yourself, or start talking with your family, mom, dad, brother, and if not that, your relatives are available,
Right.
right? Make yourself more happy and indulge in lots of physical exercise, even though you're not getting out.
Okay. Right.
Spend a good amount of time with yourself if you are an extrovert,
Okay.
because you are exploring yourself,
Right. Right.
right?
Right.
And
True.
now when I talk about introvert, is they will be facing lots of issues because
Absolutely.
they are hardly talking, barely talking to anyone. Plus, there are lots of thought hitting their minds because they are completely isolated.
Right.
They're
Right.
completely alone.
Right.
So please go and talk. If you're not comfortable with your friends, if you're not comfortable with your family,
Hmm.
go and talk to a therapist. They're
True.
always open. They're always open to share
I mean,
and
they
listen
can
to
develop
you.
some hobbies also. I mean, if they have
Yeah,
some hobbies, they can indulge in
many,
that. Yeah. Right.
many. You can write poems, you can write shairis, then you can, explore musical instruments, many things around the corner. You can journal. That's
Right.
really amazing technique.
Yeah.
Take a book, take a pen when you know I don't want to share it with anyone. Please note it down. And if you feel that something is triggering me, wrap it up and throw it in dustbin. But you'll feel calm for that particular moment.
Absolutely. So it was thank you, Sanika. I think we have just come to an end of this session.
Thank you.
So thank you for such an insightful session. It was lovely
Sure.
having
My
you,
pleasure.
and we look forward having you with us soon with the panel discussion in just another
Sure,
few
sure,
minutes.
sure.
So we'll see you there.
Definitely looking forward.
Yeah. Okay.
Yeah, thank you. Bye bye.
Bye bye.